Hi, this is Dr. Tim Smith here from New Life Chiropractic in Rocklin, California. Today we're going to talk about a chronic problem that I see here in the office every single day. That's people coming in with migraine headaches. Sometimes so severe that it's debilitating. Many times these people are coming in on very strong, powerful medications or just having to deal with it day in, day out, month after month, year after year, and it's severely affecting their life. The issue is most people are not correcting the cause of the problem, and that's what we focus on, finding and correcting the cause so the body can heal itself. The most common cause of migraine headaches that I see is the loss of the normal curve in the neck. Normally when you look at your spine, you should have a nice 45-degree curve in the neck just like this. Most people have a loss or even reversal of that curve, which would look like this or even forward like that. Now what that does when you lose that normal curve, it puts excessive stress and pressure on the spinal cord, on the nerve to the muscles here in your neck, and most importantly on the brainstem. Severe, sometimes debilitating pressure on the brainstem, affecting the vertebral arteries and the suboccipital arteries, blocking oxygen and blood flow into the brain, creating nerve stress, and that causes migraine headaches. Now the reason why this happens is because so many people spend most of their day either sitting on a computer at a workstation driving, and if they're not doing that, they're spending time throughout the day on cell phones, texting, writing messages, reading, watching TV. All of these things cause an abnormal stress and tension on the body, causing this loss of curve here in the neck, which eventually can lead to headaches and even more severe migraines. And so whenever people come in here into the office, what we do is we go through a complete health history, a complete functional spinal neurological evaluation, actually see how the body's adapting to stress, and most importantly, x-rays. X-rays looking at the spine, looking at how the nerves are being affected and how the body's functioning and healing from the inside out. Now this is one example of what an x-ray would look like when most people have headaches and migraines. As you can see right here, normally this curve in the neck needs to be 40 to 45 degrees. Now specifically with this patient here, she has a curve of only 11 degrees. And your head needs to be back over your shoulders. Every 10 millimeters you go forward is like an extra 5 pounds of stress on the muscle, spinal cord, and brainstem. Now if you look here, she's already almost out to 50 millimeters. That's 5 times the normal amount of stress. And pay very close attention to this upper part of the neck. This is where the brainstem sits. So these numbers here normally should be 18. Now this here is double. This here down here is triple the amount of stress on the brainstem and those nerves. So it makes sense that she's been having headaches and migraines for over 20 years. She came in on 3 severe medications. Sometimes her migraines would be so debilitating she'd have to lock herself in a dark room with no input for days on end. Until she finally came here into the office and we were able to find the cause of her problem. We put her on a special corrective care program here in the office centered around corrective chiropractic care. We're actually able to restore normal function of the neck, get the pressure off the brainstem and the spinal cord, and help her body start healing. So after a series of treatments here in the office, we did take an updated x-ray to see how her body is responding to that. This is the updated x-ray that we did a few months later. Now you can see what happens. We reduced that forward weight bearing head forward by over 20 millimeters. We increased that curve in her neck over double, and we decreased the stress on her brainstem and spinal cord by over 25 degrees. And at this point here, she was having no more migraines. Imagine suffering from migraines for 20 years, now having 0. She's on no medications. She's sleeping better. She has more energy, and she's starting to live her life again because we're able to find and correct the cause of her problem. And there's so many people suffering with migraine headaches right now that are not getting to the cause. So if you or somebody you know is suffering with headaches or migraines, you want to get some natural long-term relief, make sure that you're checking out the link below subscribing to these videos and sharing it with other people that you know that could benefit from this. You can give us a call here in the office. You can send us an email or click on one of the links here, comment below, and someone will get back to you as far as scheduling appointments so we can get you in for that consultation, find out what's going on, see what we can do to start helping you so we can eliminate the cause, get you living a full, healthy quality of life again.